So chiropractic care versus other interventions like surgery, other invasive things like surgery or injections. Um, Again, we believe and we know the body has the ability to heal itself. So if we had somebody with an MRI that had disc bulges, um, the surgical community they just figure it's a loose joint, so we're gonna bolt it together, and that's what surgery is. They'll go in and either trim away some of the bulging disc, kind of like if you had a callus, they would trim that away. That's not necessarily a bad idea, but it's taking away something that should naturally be there. That structure of the disc. Fusing the neck is usually we have a joke in the chiropractic field of when was your first back surgery, because then you're going to have a second and a third usually. And what we see
Mm.
is if you've got five joints that are all supposed to move, then they're all using 20% of the range of motion for that segment. 20% times five is 100%. So low back is five vertebrae. Five divided into 100 is 20. So each joint is moving 20%. If you suddenly take out 20% of movement by fusing it, the surgeons will take two bones and just fuse them together with bolts and screws. Well, suddenly that's not moving, so the joint above and below are having to take over a little extra movement to create that full range of motion. So they're doing 30% each, or one's doing 40 and one's doing 5. Extra movement that's not supposed to be there is going to cause more issues and extra wear and tear. So chiropractic, doing the alignment, doing the adjustment, doing things like decompression, stretches, other exercises like rehab, physical therapy exercises like McKinsey exercises, those will help naturally let the body reduce those bulges and actually heal the discs without surgery. And anytime you can keep your own stuff in you is usually a better idea, um, rather than just fusing something that shouldn't be there or that should be moving and blocking it together. We've all probably had a cast on our wrist, and if you immobilize that, um, for a month, you take the cast off and your wrist is half the size that it used to be and it's not moving like it should, then you're going to have issues for a while after that. So it's the same idea with fusing a vertebrae in your back. It can be good if there's some other, if it's a traumatic thing, then yeah, we need to fuse it. But many times there are other alternatives that um, allow us to help intervene in a way to let the body take care of itself.